Hi, so today we'll be talking about the anatomy of the middle cranial fossa. The middle cranial fossa. I've already done a tutorial on the anterior cranial fossa, so if you haven't watched my tutorial on that, kindly do so and please kindly subscribe to my channel. So let's begin. So we'll look at the boundaries of the middle cranial fossa, we'll look at the floor, and then we'll look at the detailed features of the middle cranial fossa. So this is the middle cranial fossa. We'll be looking at it in detail. Now, for the boundaries, anteriorly, the middle cranial fossa is limited by the posterior border of the lesser wing of the sphenoid. Okay, so the anterior border is limited by the posterior border of the lesser wing of the sphenoid. So this is the lesser wing of the sphenoid. This is the lesser wing of the sphenoid. So this is the posterior border of the lesser wing of the sphenoid. And you can see these two light projections here called the anterior clinoid process. Anterior clinoid process. Now in between these two anterior clinoid process is a depression here called the sulcus chiasmaticus. Now posteriorly, it is bounded by the superior petrous part of the temporal bone, and also the dorsum sella, where my cursor is. Now it's important to note that for the sulcus chiasmaticus, it is named after its relation with the optic chiasma, which is the crossing of the optic nerve. But what you must note is that the optic chiasma never comes into contact with the sulcus chiasmaticus, but rather it lies posterior superior to the sulcus. So this is the sulcus chiasmaticus. We said posteriorly, it is bounded by the superior petrous part of the temporal bone and also the dorsum sella. Now laterally, we have the greater wing of the sphenoid, that's here. Then we have the anterior inferior angle of the parietal bone, which is here where my cursor is. And then we have the squamous part of the temporal bone, that's the lateral border. Again, for the lateral border, we have the greater wing of the sphenoid, we have the anterior inferior angle of the parietal bone, and then we have the squamous part of the temporal bone. Now on the floor, we still have the body of the sphenoid. Here we have the greater wing of the sphenoid, we have the squamous part of the temporal bone, and then we have the anterior surface of the petrous part of the temporal bone. So we'll look at the features in detail. We'll look at the body of the sphenoid. Now we said that there's a sulcus here called the sulcus chiasmaticus, and this is the anterior clinoid process. This is the anterior clinoid process, which gives attachment to the tentorium cerebelli. The tentorium cerebelli is simply a fold of dura which separates the cerebellum from the cerebrum. Now it's important to note that there's a very small canal which is hiding beneath the anterior clinoid process. There's one here and then there's another one here. It's called the optic canal, and this canal transmits the optic nerve and the ophthalmic artery. Now the next feature we'll look at is the tuberculum sella. The tuberculum sella, where can it be found? It is just behind the sulcus chiasmaticus. Just behind the sulcus chiasmaticus. It's just an elevation, okay, which is found behind the sulcus chiasmaticus, and it gives attachment to a fold of dura called the diaphragma sella. Now we know in anatomy that diaphragm means partition. So this fold of dura is like a partition which separates pituitary fossa underneath it and also the rest of the cranial cavity. Now moving on to the lateral border of the body of the sphenoid. So this is the body of the sphenoid. The lateral border is another sulcus called the carotid sulcus. Carotid sulcus. Now this sulcus is related to the cavernous part of the internal carotid artery along with its sympathetic plexus. Okay. Now looking at the posterior border of the lesser wing of the sphenoid. Now this is the posterior border of the lesser wing of the sphenoid. Okay. We'll see that there's a fissure here which is called the superior orbital fissure. Now this fissure is found between the lesser wing of the sphenoid. This is the lesser wing of the sphenoid, and this is the greater wing of the sphenoid, and then medially is bounded by the body of the sphenoid. Now it is a long fissure which communicates the middle cranial fossa with the orbit anteriorly. Now the lower border of the fissure shows a projection. It's not very clear here, but the lower border of the fissure shows a projection which gives attachment to a common tendinous ring of Zinn. Now this musculotendinous ring gives origin to few muscles of extraocular muscle. Now the ring divides the superior orbital fissure into 3 parts. So I show you here now. So this is the ring, the tendinous ring of Zinn, which divides the superior. So from here to here is the superior orbital fissure. It divides the superior orbital fissure into 3 parts: the lateral part, the middle part, and then the medial part. So we'll see the structures that traverses each one of them. So we can see that for the lateral one, we can see that we have the lacrimal, the frontal, and then the trochlear nerve. Also traversing this, we have the superior ophthalmic vein, the meningeal branch of lacrimal artery, and then also the orbital branch of middle meningeal artery. Now for the middle part, we have the oculomotor nerve, the ciliary nerve, and then abducens nerve. And then the medial part, which is this one, is the inferior ophthalmic vein and also sympathetic nerve. Now we'll talk about the foramen. The foramen that is present on the greater wing of the sphenoid. So this is the greater wing of the sphenoid. We'll talk about the foramen. Now there's a foramen here called the foramen rotundum. Foramen rotundum. It's not too clear here, but it's called the foramen rotundum. And you have the maxillary division of the trigeminal going through this foramen. Okay, maxillary division of the trigeminal, which dilates to the pterygopalatine ganglion. Then we have the foramen ovale, this big one here. The foramen ovale, this is the foramen ovale, this one here, this is also the foramen ovale. Okay, so you have the mandibular nerve going through the foramen ovale, we have the accessory meningeal nerve, we have the lesser petrosal nerve, and then we also have the emissary vein. Then we have the foramen spinosum, just inferior-lateral to it. Foramen spinosum, this one, this is the other one. Now the structures going through the foramen spinosum, we have the middle meningeal artery, the nervus spinosus, which is the recurrent meningeal branch of the mandibular nerve. Okay, then we have foramen lacerum, so just beneath the area of the cavernous sinus, just beneath it, this is the foramen lacerum. Okay, you have the meningeal branch of the ascending pharyngeal artery going through it, and also the emissary vein. Now we'll continue looking at the features. We'll look at the posterior border. So we'll look at the petrous part of the temporal bone. This is the petrous part of the temporal bone. Okay, here is called the petrous apex. Okay, the medial end is called the petrous apex. Now in the petrous apex, you can see a depression here. This is the depression. You can see a depression here. Okay, you can see a depression here called the trigeminal fossa, and it contains the trigeminal ganglion. Okay, then you can see an elevation of this bone here, okay, called the arcuate eminence. Elevation of the petrous part called the arcuate eminence. Okay, and this is formed by the superior semicircular canals. Then just on the superior border of the petrous part of the temporal bone, there's a groove. There's a groove here. It's called the superior petrosal groove, and it lodges the superior petrosal sinus. And you can see that the margins of the groove provides attachment. So this is the margin of the groove. This is the margin of the groove. This is the margin of the groove. It provides attachment for the tentorium cerebelli. Now in this groove is so you can see also here there are also grooves made by the middle meningeal vessels. This one, there are grooves here, there are also grooves here, and these grooves are made by the middle meningeal vessel.